Hello everyone, my name is Kelly Frost. I am a registered dietitian and a part of the clinical support team for Nordic Laboratories and DNA Life. And the purpose of this session is really just to give you a bit of an overview to the changes and updates to the new Dutch report. There was a first sort of round of changes a couple months ago, and these are newer updates since then. The changes will be launched mid-October, and hopefully by the end of the session, you feel a little bit more comfortable and confident in these changes in the report layout. Okay, so just to give you a bit of an overview of what has changed. So obviously this is all listed in text format. I'm going to show you exactly what this all means when I take you through the report. So what has changed? An expanded hormone summary page. So there is now clear reporting of parent hormone levels alongside metabolism patterns, estrogen metabolism phase 1 and 2 sliders, an androgenic 5 alpha metabolism sliders, a few changes to the adrenal section of the report. So there is now patient-specific collection times that have been added to the x-axis of that graph. Free cortisol plots points colors shown in or out of range, so that makes it a little bit easier to interpret abnormal values on that graph. Additional points plotted on the pattern, including a mid-sleep sample if collected for the Dutch complete. A calculated CAR in the table, that is for the Dutch plus. An organic acid alert section highlighting any results requiring attention. Changes to the expanded sex hormone graphical page. There is a new 5 alpha metabolism progesterone slider. And the phase 1 estrogen metabolism pie chart is retiring. So I will explain that in a little bit more detail when I get to that section of the report, just to explain why it is beneficial that we look at other data points instead of looking at that pie chart. The total DHEA production dial is now also added to the androgen section. And lastly, the Dutch dozen about your results. So an expanded interpretation summary at the end of the report that really gives a really lovely interpretation framework to the results, which should make it a little bit clearer to understand and easier to understand the recommendations and the interpretations of the results. Okay, then this is the hormone testing summary page. So you'll see the left-hand side of this section really includes the estrogen and progesterone production, whereas on the right-hand side, we're looking at hormone metabolism patterns. So yeah, the updated summary page really just includes a new estrogen metabolism section, showing phase 1 and phase 2 estrogen metabolism ratio, the 5 alpha metabolism slider for androgens, and also just new features, including the addition of patient collection times on the x-axis, as I mentioned previously. Those are reflected on the free cortisol diurnal pattern on the graph. And then it also includes, if you look at the very bottom of this summary, you'll see the new oats section. So that highlights organic acid results that may need attention, and those are shown at the bottom of the page. So where an organic acid result is highlighted in red, we know that that needs attention, and most often is reflected in higher values. Melatonin, though, will be red if it is very low. And then if it is marked in yellow, it means it needs to be monitored, and we need to watch those labels to make sure that they don't adjust or change in any way. Okay, the page order has also changed. So you'll see the graphical pages for the sex hormones and the adrenal hormones will now be pages 2 and 4 of the report, respectively. And then the organic acid page remains on page 6. And then the 2 list style pages for sex hormones and adrenal hormone results will still be in the report. They kind of each follow their graphical page, respectively, pages 3 and 5. And then pages 7, 8, 9, towards the latter end of the report, is the about your results section. So termed the Dutch dozen, I will elaborate on that a little bit later on in the presentation, but that is the interpretive framework that I mentioned, that gives additional commentary and insights into the results that have come up within the report. Into the graphical page enhancements. So this is the metabolism pathway that you're all fairly familiar with. You will see on the left-hand side, there is the total DHEA production dial that was from the summary page is now also shown as part of the androgen steroid pathway on this page. And the DHEA dial really represents the sum of DHEAS, etocolinone, and androsterone, which are each seen individually in this report. If you see on the right-hand side, the 5-alpha metabolism slider, that is a calculated ratio that assesses the patient's potential for 5-alpha metabolism. And this is really most relevant in women who are cycling or who are taking oral progesterone. And for that reason, this is only reported in a female report. Okay. And then lastly, at the bottom of this page, you will see that the pie chart that you are somewhat familiar with is no longer included in this report. So the reason for this is that newer research has really highlighted that the potential impacts of the 4-hydroxy and 16-hydroxy pathways are best assessed by comparing each individually to the healthy 2-hydroxy marker as a ratio. So while the pie chart still identifies most issues that can arise with phase 1 estrogen metabolism, in certain cases, like if one metabolite is significantly out of range, what happens then is that the balance between the other two ratios can be visually and numerically skewed. So the 2-hydroxy, 16-hydroxy, and the 2-hydroxy, 4-hydroxy ratios, which you can see on the left-hand side, the slider bars are still provide the most clinically reliable evidence-based information on phase 1 estrogen metabolisms. And more specifically, if there is any outlier cases that can skew that ratio. So I'm going to show you an example on the next slide where you can see this. So if you have a look over here in the pie chart, if you look at the 4-hydroxy, the percentage is sitting at 6.4, which is nicely within range. However, if you look at the sliders slightly above, 4-hydroxy is heavily favored compared to the 2-hydroxy. So the use of the pie chart was often limited by the dominance of one pathway. As I mentioned, you can see in this example that is 16-hydroxy. And because it is so preferred, the ratios are obscured. So if we compare the ratios to the 2-hydroxy pathway individually, we have a better idea of pathway preference and how best to prioritize certain pathways in this report. Okay, looking at the adrenal hormones and metabolites. So you'll see the complete is on the left-hand side and the Dutch plus is on the right-hand side. So new changes that are included really just include colored points. So you'll see if they are green, that means that that point is within range, and red means it is out of range. So visually, that makes it easier for us to determine any points in the day where that collection is inaccurate. And then time-specific collection. So you'll see the specific times that that patient collected the result, the sample is listed on the x-axis. So that is their time that they collected that specific sample, which also makes it easier for practitioners to understand potential collection errors and that kind of thing. And then in the Dutch plus, you'll see in the top right-hand side, there is also a percentage cortisol awakening response rise, which is listed on the top right-hand side, which does make it easier. The Dutch Plus has also always offered an additional collection tube labeled the insomnia sample, and the results for the sample were previously reported in a comment below the diurnal curve. Now, this additional sample is reported as part of the free cortisol diurnal graph when collected, and patients can also use that sample midday, and that would be showed. So, if you're not using it as an insomnia sample, you can use it midday, which is shown on the right hand side where that arrow is. So, you would just collect it then, and that would be interpreted within that graph. Okay. Okay, then going into the Dutch dozen, as I mentioned. So on the updated hormone testing summary page, obviously this features three hormone stories divided into estrogen, androgens, and then cortisol. And then within those three sections are 12 key Dutch elements that are curated to tell those hormone stories. And those are termed the Dutch dozen. So as you'll see, 1 to 12, that is a dozen, and that is the Dutch picture that tells the story. So if you look, as I mentioned earlier, about your results section of the report, this is the interpretive framework, and really how we interpret this section is each key element in the hormone categories 1 to 12 will be laid out in the about your results, each referencing each specific section. So where estradiol is marked 1, you will see 1 in the about your results column is the interpretation which is correlating to that specific marker in terms of the results, the commentary on it, how to better interpret it, that kind of thing. And that goes all the way from 1 into 12, as I said, respectively correlating. So this should guide patients and practitioners when trying to understand and interpret their results. It makes the framework of the report a whole lot easier to understand, inform sort of a story and a flow of the results, which, as I said, should just make it a little bit more clear and hopefully a little bit better understanding. Okay, then the last little thing I just want to mention is the differences between the male versus female report. So the only real differences is that the male report, you'll see that the androgen section is prioritized on the top of the report, and the E1 to E2 balance is emphasized. Whereas in the female report, the estrogen section is prioritized and the progesterone estrogen balance is emphasized. So those are the real differences between the male versus female report. Okay, and then lastly, there are lovely articles that are available that will elaborate on it. I've obviously done a snapshot overview of the main points of the changes that will be coming to the Dutch test. But if you want to read up further on the details of the report, these are very helpful references and to articles that you can expand your knowledge on. And as I said, hopefully give you a little bit more insight into the report and give you a bit more clarity. Thank you for your time. Have a lovely day, and we'll speak soon. Bye.